This is the spinal motion restriction skills video for the UCLA Center for Prehospital Care. There are two important concepts for spinal motion restriction. First, manual stabilization of the cervical spine. This occurs during the scene size-up portion of the patient assessment. The second is the decision to apply the cervical collar and perform spinal motion restriction, which is considered a treatment and is performed following the secondary assessment. Manual stabilization of the cervical spine, that first part, is seen here, where an EMS provider holds the patient's head such that the cervical spine is in a neutral inline position. Remember, this is performed during the scene size-up. The second part of the spinal motion restriction is applying the cervical collar and securing the patient in a supine position. This occurs as part of the treatment phase. Any patient who's suffering from blunt force trauma and is suffering from one of the listed conditions should have a cervical collar placed and be lying in a supine position on the ambulance gurney, scoop stretcher, or vacuum mattress. The conditions include an altered level of consciousness or a patient being unable to answer questions appropriately, midline neck or back pain or deformity, numbness or weakness in an extremity, or a distracting injury which impairs the patient's ability to contribute to a reliable exam. The following is a demonstration of how to apply the cervical collar, starting with the sensation, motor, and pulse checks.
I will then ensure my patient has a good pulse, motor response, and sensation in all four extremities. Next, I will properly size and apply a cervical collar to the patient's neck.
Applying a cervical collar requires that you fit the cervical collar to the patient. You saw in the video, measuring for the cervical collar involves finding the space between the patient's chin and the patient's shoulder. Typically, this is done with the finger lengths of the EMS provider. You can see in the pictures here, it is approximately 4 finger lengths from the patient's chin to the patient's shoulder. Those 4 finger lengths can be used when applying the cervical collar as seen in the other picture, which is the EMS provider using their 4 fingers to measure from the sizing line on the cervical collar to the bottom of the C collar. The C collar or cervical collar can be extended if it requires more or less distance. It is important to properly size the C collar so the patient's head remains in an inline neutral position. Next, you need to decide how you're going to get your patient onto the ambulance gurney. In a conscious trauma patient, you should remind your patient that they should limit the movement of their head as much as possible. This means not moving their head from side to side or front to back. You will then assist your patient to a standing position, have them pivot and sit down on the ambulance gurney, which you have positioned as close to them as possible. You and your partner should work to assist the patient, which may require you to help hold the head in a neutral inline position. In an unconscious trauma patient, you will have to log roll your patient onto a long backboard or utilize a scoop or flat. Ensure you are holding the head in a neutral inline position if you're log rolling the patient. The EMS provider in the position of the head is in charge of this move. The following is a demonstration of how to properly secure your patient to a long backboard following a log roll.
Position a long spine board next to the patient. Rolling the patient onto his or her side may take additional team members to prevent lateral movement of the patient's spine. When ready, the person holding cervical immobilization will be in charge of when the patient is rolled. While the patient is on their side, I will palpate down the patient's spine, feeling for step-offs, and listen for the patients to report tenderness or pain. The person holding cervical immobilization will again direct the patient to be rolled back down onto the long spine board. The patient will need to be moved up and down to ensure he or she is secured to the center of the board. This will mean the person holding cervical immobilization directs the team in sliding the patient down and towards the center of the board and then back up. So then the patient's head is at the top of the board. I will start by securing the patient's torso and hips to the long spine board, followed by the patient's legs.
When placing the patient on the ambulance cot, remember to use good lifting technique when lifting the backboard, scoop stretcher, or flat. Once the patient's on the gurney, remove the patient from the backboard, scoop stretcher, or flat, and secure the patient to the gurney using the gurney straps, ensuring to use at least 4 straps, including going over the patient's shoulders. If you used a backboard, remove the patient using the same log roll technique. Prior to completing the skill, ensure you also check for circulation, motor, and sensation in all 4 extremities. Remember, there are times when you are not required to do spinal motion restriction, and this includes patients suffering from penetrating injuries and patients who are ambulatory on scene. Patients who are ambulatory on scene may have a cervical collar applied and may be secured supine on the ambulance gurney. This concludes the skills video for spinal motion restriction.